welcome to this next in our series. And today I am talking with Mariola Espinosa. And Mariola is the director of the Global Health Program and also in the History Department, and was a Fellow-in-Residence last spring, I think, at the Obermann Center. And so given the nature of both her current book project and her past one, I thought she would be a fascinating person to talk to. So Mariola, if you wouldn't mind just giving us a little background on those two projects.
Sure. Thank you for having me. It's good to kind of get out of my office and talk to someone about something else. I am a historian of medicine and public health in Latin America and the Caribbean, and my first book looked at the ways in which yellow fever played into relations of power between Cuba and the United States. So I started with how epidemics of yellow fever in the South motivated partly the United States to intervening in Cuba in the war with Spain in 1898, in the Spanish-American War, and how the subsequent relationship between the two countries also was shaped by concerns about epidemics. And then from there, I moved on to my next project, which is still ongoing, which pulls the lens out of the island of Cuba and looks at the Caribbean as a whole. And I'm looking at the ways in which people in the region, and by people in the region, I mean Europeans, so French, Spanish, British, also Americans, the United States, but also Americans from the Caribbean, and people on the ground really understood fever as one of the biggest threats to the region. So I'm trying to work on a book that looks at how physicians understood fever when they didn't know it was transmitted by a mosquito, how they rationalize it, how people enacted the knowledge, and when and why, and what types of relationships.
And just to help us remember, around what time period are you?
It's a long time period. So I start kind of in the middle of the 1600s all the way to 1900.
Okay.
So from the first time we see in the records a mention of a yellow fever or some sort of evidence of yellow fever, all the way through until the mosquito vector discovery.
All right.
Yeah, so big, lots of years.
Yeah, yeah. So how have these past few weeks, I mean, now we're reaching months really, but how has this been resonating specifically with that work?
So there's certain things that I think about that I think of as a historian of medicine. So I'm looking at reports coming out from the beginning. So the types of sources that we get information from, so press, to compartmentalize like what we know about the virus and how the virus affects humans. So those are two separate things that I identify in yellow fever, and I'm kind of thinking about those things and how people understand them now and are learning about them, but also how one of the biggest things that I learned in my books is that the panic is really bad, and that their reaction to the unknown is as bad as an epidemic in some cases. And how states react and how different people react also really shows what the priorities are or what knowledge is in terms of what we think of as history of disease or history of a country. So those things are resonating a lot as we see local states reactions or city council reactions or Johnson County reactions in our case, right? And how they articulate those preoccupations.
Yeah, and it's so confusing because you're hearing different things from different levels.
Yeah.
And
so who do you listen to, and what the sources do you go to? And if you wake up in the morning and check Facebook and Twitter, like, what does that do to the rest of your day? But also, how do you digest that information?
Mm-hmm. Mm-hmm. Yeah. And so you were talking about looking in the past at states closing, potentially closing borders, and that was the state's prerogative to do so, and then that a national board of health was set up to maybe help with that confusion. I don't know if describe that.
There's in the late in the late 19th century. So enshrined into the laws of this country is the fact that states have their own rights, and health is one of those, right? So health is the purview of the states, not of the federal government. So when you have in 1901, for example, the US government telling the Cuban government that in order for them to be independent, they need to sign into their constitution an amendment that says that they will stay clean to prevent for epidemics coming from Cuba to the south of the United States. The lawyers involved in crafting that argument were really hesitant to do so because they wouldn't ask that of their own states in their own country. How can you ask that of an independent country, right? So there were these conversations back and forth and arguments back and forth about how you can ask of a country something that you wouldn't be able to ask of a state within the Union. And later on in the early 20th century, there's epidemics of yellow fever that affect states differently because states have different resources and allot them in different ways. And so at some point you have a battle between I think it's Mississippi and Louisiana, where there's a lake in the middle and there's battleships going because they are not preventing the spread of disease. These types of conflicts in the early 20th century US generate the need for a national board of health. And so there's this national board of health that's created to regulate this issue that is a state's right, but that when it crosses, it threatens, right? It threatens the nation as a whole. And there's a creation of a national board of health that's there for a few years, but then it gets disbanded. Right? So we don't really have that. And we hear these conversations today about, you know, it's up to the states to have their supplies ready, and you know, when does the government step in? Or if we hear about quarantining a state, or Texas threatening Louisiana, all these things. I've seen documents about yellow fever in 1878 saying the same things.
Mm-hmm. Mm-hmm. Yeah, and it seems some of that so unique to the US as opposed to a European country that doesn't.
I mean, yes and no. If you look at Spain right now, you
Mm-hmm.
see how different cities are having their own reactions to controlling things. Like there's cities that their authorities decided to just close the streets and put barriers and nobody can go in and out. So differently, to a different degree, but I think that we see all over the place, which we just don't see it as much because we're getting all about the US right now. But I mean, there's cities in Spain that are completely closed up.
That's helpful. Yeah, I think I get so just, you know, the states versus the federal and who can control what, and intrigued by that.
I mean, it'll be interesting to see, like, the conversations that Johnson County is having about the legality of Johnson County deciding on a stay-at-home order, whether it can or cannot, with or without the governor. And it's all about how can we read the law to allow us to do what we need to do, or what we feel like we need to do to protect the people that reside within our purview. And it gets interpreted differently, and then it generates repercussions.
And then another echo that really struck me from your projects is around the racialization of a virus.
Yeah.
If you can just reflect on both what was happening within the area you're studying and then more recently.
So I have an article that looks at how yellow fever was one of those diseases that was thought to be, and still is by some, one of those diseases that you can say that people of African descent are less susceptible to. And that's an argument that was made by slaveholders in the Caribbean, in the south of the United States, anti-abolitionists, to justify the continuing of slavery in the economies that were reliant on that, sugar, cotton, whatever. So not just a strictly US phenomenon, Caribbean as well. And if you look at the sources, and this is 19th century stuff and earlier, if you look at the sources, you can see that that's not the case, right? So there's a historian whose name is Rana Hogarth, who just wrote a wonderful book called Medicalizing Blackness, where she talks about some of these things and other diseases. But in conversations with her, she and I talked about how there's records of shiploads of slave ships coming to Barbados that come sick, right? So all the people on board who are enslaved are also sick of yellow fever. They just don't appear when you look at statistics in some cities because they're counted differently, right? So then when you look at statistics, it looks as if that disease affects white people more than blacks, thereby allowing for those types of statements, even though it's just a matter of who gets counted, right? Mm-hmm. So our enslaved people in the plantation is going to get counted the same way as whites in hospitals in New Orleans, for example. And so when I look at this in my book now, I can see that this medical understanding of a disease in terms of its etiology and how it affects people of different races or different genetics, if you will, is something that is always in the back of my head. It's something that I'm looking at because people talked about it a lot, but then didn't have the evidence for it. Mm-hmm. And so when the first famous people in the United States started saying that they were diagnosed with COVID-19, like it was these basketball players, right? And so there were rumors, rumblings about how, look at them, they're so healthy, they have it, but they're not manifesting symptoms, right? That has to do something with their racial susceptibilities. And immediately, historians who touch on this raise the alarm that we can't make these types of conclusions, that these conclusions are based on racist understandings of disease and they're not based on actual data, given the fact that we don't really have good tallies of how many tests and who gets tested and why, right? Mm-hmm. So there's that going on. There's also the finding the blame in people of Asian descent. So the attitudes towards others for bringing diseases. That's a really prevalent narrative in colonial histories, where you have Europeans going places and getting of disease because they're darker skinned or because they live in those environments. And those same types of narratives appear occasionally here and there as we're reading about finding who gets sick in China and why. Mm-hmm. So those are a lot of the things going on, and we can't talk about this without, even more recently this week, the reports that when you look at the statistics, and I mentioned this in New Orleans or Chicago, they're raising the alarm that it's affecting the majority of cases are in African American communities, which shifts it a little bit, right? So they are susceptible. So it defeats that argument that they were making previously, but also demonstrates that disease is also based on these social preconditions, right? On the ways in which societies are structured that are unequal, that are racialized as well.
We were talking a little bit about the activity of medical historians right now, like on Twitter and probably other spaces as well, and the conversations you all are having. And in part, you were discussing this sort of like what I took as almost a notion of do no harm. That on one hand you have a lot to share right now and a lot of knowledge, and then also an awareness of the limitations.
Yeah, and it's interesting to see how at the beginning I thought that it was just me as in feeling insecure right? Like I am an expert on epidemics, and when the university was collecting their list of experts to have ready in case the press came in to want to talk to people, they emailed me to see if I wanted to be on the list, and I really hesitated because while I am an expert on the history of epidemics, I'm I don't know about this one, right? And we rely, historians of medicine more and more rely on the interdisciplinarity of knowledge, and kind of listening to epidemiologists and listening to physicians, and not being afraid of the jargon, and really engaging with that knowledge and working together to really understand the past. So I think those conversations are happening right now. But also the fact that I might know a lot about yellow fever um, in the 19th century and early 20th century. And I can tell you that what I read about the figures and the people whose work I read about their experiences going through yellow fever really engendered emotion in me. I can't compare what I'm feeling right now to that, right? So as also as somebody who's going through this as well, and the fact that I don't know a lot about this disease. I'm learning, but I don't know a lot about it. There was one historian who published something, I can't remember exactly where he put it, but he linked it on his Twitter feed, basically saying, yes, we are all experts, but we really don't know anything in this way. Like we have to, there's all these conversations about like, what do we learn from the plague that we can apply to this? Or what did we learn from smallpox that we can apply to this? And really it's nothing about the disease, but maybe all about the state reaction, I think. But we as historians need time and perspective, kind of distance from the event, to really start to understand what we're going through. And that's how I feel. Like I would feel irresponsible making that comparison to say like this is how it happened in yellow fever and this is how it's going to happen now, or this is what we're seeing, because it changes every day, and I'm learning.
Mm-hmm.
Yeah.
And the final thing that I just wanted to touch on that you mentioned, because you were talking about teaching, and right now you're teaching an undergraduate class about Cuba.
Yeah.
And in talking to your students, you said you reminded them not to judge, what was it, the actors
Yeah.
of,
One of the things that and when I teach my other classes, the histories of disease and medicine, so it's hard for students to get this, but they eventually do, is that it's really hard for us not to judge people from the past because they didn't know something that we know now, right? So the big one is like bacteriology. Before the advent of bacteriology, the thought that filth generated disease, but that there were these bacteria, it's like that just made no sense. And we can't judge people who didn't know that bacteria existed, who didn't know that viruses cause disease, for acting the way they did and understanding diseases the way they did, right? And so when I talked to my students as this started going on, so the history of Cuba class is actually about to talk about medicine in 2 weeks. When we talk about, and you might be hearing about this in the press, the Cuban physicians who go out to the world to help, right? So we have a section on how Cuba has become a leader in that type of medicine, but that's in 2 weeks. But when we were talking about their own experiences, or talking about preparing for the class, and when I said, make sure you take your books when you go home for spring break, just in case you can't come back. I also talked to them about how they felt, and some of them were feeling, well, we don't know what's coming, or what do you think about transmission, or what do you think about these things? And I said, just pay attention to your sources, right? So make sure that you're getting information from sources that you find are reliable, and be forgiving of the knowledge, right? So if you thought you were going to go on a cruise during spring break, and you did, and then within a week you find yourself completely feeling irresponsible for having done so, don't judge your decision from the past, because in the past you didn't have the knowledge that you have now to have made that decision,
Mm-hmm.
right? And that's, what I keep trying to show him, that the people we read about lived in the past, and we have to keep in mind that they don't know what we know today, right? That's basically how not to judge them in those ways.
Mm-hmm. Because people will be reading about this in the
Yeah.
future. Yeah.
Yeah. But also be forgiving of themselves. Like, that's the thing, when they decide that they want to keep on working, or they want to stay in the dorm, and then they decide that was a bad idea. I was like, well, it's a bad idea because now you have more information that you didn't have in the past.
Mm-hmm. Great. Thank you so much. I really appreciate your time and for
No,
sharing
thanks for
all of
having
that.
me.